Santosh sir, please unmute.
Now it is audible, ma'am?
Yes sir, please continue sir.
Yes. First, we'll start with the exam-oriented osteology. The osteology, the first we have to start with the skeleton actually. The what is the skeleton actually? The skeleton is nothing but the science concerned the bony and the cartilaginous framework of the body is called as a skeleton. So in that actually the osteology, which is concerned about the bones only, the science which concerns with the study of the bones is called as a osteology. The first many of the students, they know the clavicle, they know the humerus, they know the skull bones, but they don't know what are the basic things actually. If you'll ask for the how many bones are there, where they are situated, and the classification of the bones, even though they don't are able to answer. If they can able to answer the skull bones, but they can't able to answer the, these are all the basic things actually. The first osteology, the book, the best book to refer the osteology will be the osteology, the handbook of osteology by the Poddar. The first 20 pages of the osteology Poddar is very 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 important actually. Okay, many people they will neglect actually. Directly they will start from the upper limb bones to scapula and all, but you should know about the what are the bone, means how many bones are there, how it is divided, and the classification of the bones. Each and everything is very important. And first we'll start with the totally the number of the bones will be 206. The two parts of the skeleton will be there. One is the axial skeleton and the appendicular skeleton. The axial skeleton, which forms the central axis of the body, and appendicular skeleton, which is the limb, the bones of the limb, it is called as a appendicular. The axial skeleton, which consists of the 80 bones, that which forms the axis of the body, central axis of the body, which supports and protects the organs of the head, neck, and the trunk, which includes the skull bones, that is the cranium and the face, which included 22 numbers, and ear ossicles it will be 6 in number, and hyoid bone it will be 1, and vertebral column it will be 26, and thoracic cage it is the ribs 24, and sternum will be 1. Totally this is the 80 bones which forms the axial skeleton. Then comes with the appendicular skeleton. Appendicular skeleton means the bones which forms the limb. Okay, that is both the upper limb and the lower limb. Totally 126 bones are there in our body. The upper limb, which consists of the 64 bones, and lower limbs consist of the 62 bones, and the bony girdles, which is the shoulder girdle and upper limb, pelvic girdle, and the lower limbs. These are all the classification, means some of the important bones in the appendicular skeleton. Next comes with the functions of the bone. This is also very important actually. Sometimes it is asked for the 2 marks question. Sorry, now it is the 2 marks, it is converted into 3 marks question now. It is the rigid framework. The first one is the rigid framework of the body and surface of the attachment of the muscles, tendon, and the ligament. It serves as a levers for the muscle for the movement and protection of viscera. Okay, like the how the cranial wall which protects the brain, and the thoracic cage which protects the heart and the lungs. Okay, like this it will be protect the viscera, and contains the marrow, which is the factory of the blood vessel, and stores of the calcium and the phosphorus, and paranasal ear sinuses affect the timbre of the voice. These are all the important functions of the bone, because whenever there is a, the functions will be there. Okay, you have to write minimum 3 to 4. It is depend upon the questions, depend upon the number of the marks. Next we will come to the classification of the bones. Okay, you should know that the many people, if they will write the classification, means directly they will start from the long bone, so short long bone, so short bone, so these are all the classification they will write. But there are the totally the 4 headings, the classification of the bones you have to write. The first one is according to the position, second one is according to the size and shape, according to the gross structure, according to the development. These are all the 4 categories you have to explain the classification of the bones. The first one is according to the position. Here, according to the position, there is an axial skeleton that forms the central axis of the body, and appendicular skeleton, you know that actually it's the limb bones. Okay, here according to the size and shape, there is a second category. There is a long bones, short bones, flat bones, irregular bones, pneumatic bones, and the sesamoid bone. These are all the seven category which is come under the size and shape. Many of the people they will miss only directly. They will start from the this category actually the classification. But here the question is the classification of the bones. It is asked for the 5 marks, so that you have to explain the based on the according to the position, according to the size and shape, according to the gross structure, according to the development. All the four category you have to answer, then only you will get the full marks. So this is regarding the according to the size and shape. Here the long bones, you know that actually the humerus, radius, ulna, femur, tibia, fibula, these are all the examples of the long bones. Here the one special bone is there, that is the clavicle. It is one of the all the what is the speciality of the clavicle as a long bone. Here all the long bones are situated vertically in our body, but here in the clavicle, which is a horizontally situated long bone actually. So this is the one speciality of the clavicle in the long bones. In the short long bones, the metacarpal bones, metatarsal bones, and the phalanges bone. Okay, these bones which is included in the short long bones. Then comes with the short bones. Short bones are the carpal bones and the tarsal bones. Carpal 8 carpal bones and the tarsal bones will be 7. They are come under the short bones. Then comes with the flat bone. Okay, because the anatomy itself it is deals with the structural study. So this classification it is depend upon the structure of the bone. So the bone itself, the shape of the bone it will be flat in nature. So it is called as a flat bones. The bones in the what of the skull, ribs, sternum, and the scapula. Okay, these are all come under the flat bones. Then comes with the irregular bones. The what are the irregular bones? The vertebrae, hip bone, the bones of the base of the skull. Okay, these are all come under the irregular bones. Then comes with the pneumatic bones. Pneumatic bones, maxilla, sphenoid, and ethmoid. Okay, pneumatic means the air-filled spaces which is present inside the bone. It is called as pneumatic bones. Okay, example will be maxilla, sphenoid, and the ethmoid. And sesamoid bones, it is a seed-like structure actually which is originated in the tendon. So that patella, pisiform, and the fibula. Fibula is originated in the lateral gastrocnemius muscle, the tendon of the gastrocnemius. Pisiform, it will be flexor carpi ulnaris muscle, and the patella, it is inside the quadriceps tendon. Next comes with the according to the gross structure. Here, the gross structure, there are the three categories. One is the compact bone. Compact bone means the bone which is having the hard. Okay, that is called as the bone cells which is arranged very closely. So this forms the hard structure that is called as the hard part of the bone. It is called as a compact bone. And cancellous are the spongy bone. It is a soft because there is a loosely arranged. Okay, the bone cells, their arrangement of the bone cells, it will be loosely arranged. So it is a spongy in nature. Diploic bone. Diploic means it will be like this. The both side, it is in the externally, it is a compact, and internally it will be compact. Okay, in between the two compact bone, there is a spongy bone. It is present. So it is called as a diploic bone. For example, here you can see in the skull bones actually. Okay, in the inside there is a compact bone. Okay, outside also there is a compact bone. In between these two pieces of the contact bone, the compact bone, this is called as a spongy bone. This is called as a diploic bone. Next, according to the development, the one is the membranous bones. The skull and the facial bones, it is a membranous because initially it will be membrane, then it will be converted into bones. It is called as a membranous in origin. So it is called as a membranous bones. The cartilaginous, first initially it will be cartilage, then it is converted into bone ossifies and it forms the bones. That is called as a cartilaginous. So that there are the two development, the two types of ossification will be there. One is the membranous ossification, one more is the cartilaginous ossification. The ossification is nothing but the formation of the bones. The one is the membrane. The initially it will be membrane, then it will be converted into the bones. That is called as a membranous in origin. That is called as a membranous bones. and cartilaginous bone, which is initially it will be cartilage, then it will be converted into cartilage. That is bone actually. It is called as a cartilaginous bone. So the limbs bones and vertebrae column and that is thoracic cage, all are it is come under the cartilaginous bone. The membranous bone, the skull bones and the facial bone. The one is important long bone which is having the membranous in origin, that is called as a clavicle. Clavicle is membranous in origin. Then comes with the art of writing the bones. Okay, you know that actually the some of the people in the question actually they will write about the radius, write about the clavicle, write about the write in detail about the scapula, clavicle, humerus, any other bone, any of the bone actually in the, okay, how to write, that is also very important. The one is the introduction. First introduce, that is the bone, whatever the given actually, that is a bone. Then comes with the type of the bone. The many people they will miss this type of the bone, or sometimes what happen actually, this type of the bone you have to they will write it only the long bone. Okay, in all the four categories, according to the position, according to the position, according to the size and shape, according to the gross structure, according to the development, all the four category, this bone belongs to which category, all this you have to write as a type of a bone. Then comes with the parts of the bone. The parts means actually giving before giving the side determination points, first you have to write the explain the parts. Why these parts is very important before we have to explain the side determination? Because because the side determination points has to be explained on the basis of the parts. So because of that reason, parts you should know. The first you have to write the parts. Then after that you can explain the side determination point. Then the neat label diagram is also very 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 important. Why? Because the no one will have a time to read your theory paper actually. So that first the impression will be you have to draw the neat label diagram. Then the all the parts. If you'll see the diagram, okay, examiner will see the diagram actually, so you can understand that which level your understanding capacity and how much thorough of this bone they will come to know. Based on that, the same thing whatever you are drawn actually, that one only you are explained in the writing part. So that if your image will be there, no, if your diagram will be there, no, if it is contains all the parts actually, then it will be easy to evaluate and you will get the very good marks also. Then comes with the after the neat label diagram, you have to write the side determination points of the bone actually, that particular point. Okay, side determination. If it is axial, then you can write it axial bone only. Okay, axial bone. If it is a one bone, actually it is a axial bone. You can write. Then comes with the description of the bone. In the description, actually you have to write the borders, so parts of the bone. Okay, parts of the bone, that is upper endo. Okay, shaft to lower endo. Then comes with the description regarding the upper end, or description regarding the shaft, or description regarding the lower end. That everything you have to explain it in the description part. Then comes with the muscle attachment. The muscle attachment means the part wise muscle attachment is very very important. Part wise. Okay, for example actually, if you are writing about the clavicle actually, the medial two-third and the lateral one-third of the shaft, so that first you have to explain with the lateral one-third, then along with that you have to attachment also. Okay, in the lateral one third actually there are the two surfaces will be there, two borders will be there. Okay, superior surface and the inferior surface, anterior border and the posterior border. Anterior border, it is having one tubercle, it is called as a deltoid tubercle, so it gives origin to the deltoid muscle. In the posterior, that is called as a trapezoid, trapezoid part, here there is a trapezius is inserted. Okay, that actually in the superior surface there is an encroachment of the deltoid and the trapezius muscle, and inferior there is a conoid tubercle will be there in the posterior inferior part, and the inferior part there is a trapezoid ridge is there. Like this you have to explain. Okay, while explaining the parts only, you have to add the muscle description also. Then comes with the blood supply and the nerve supply, and the nearby artery, it is a nutrient artery, it will supply to the supply to the bones actually, that you have to write it. Then comes with the very important is applied anatomy. The applied anatomy is means it is nothing but the clinical anatomy. Why we have to more stress on the applied anatomy and the clinical anatomy? We should know that, okay, if the clavicle is there, okay, The clavicle, the structure of the clavicle, you know, in the anatomy you know that actually structure of the clavicle. But if the fractured, okay, if you want to see the any abnormality, how you will come to know? Okay, with the applied anatomy only, in the clinical anatomy only. Because if you don't know the anatomy of the clavicle, how you will identify in the clinical? Because you don't know the clavicle, how it is situated, where it is situated. And if you don't know the what is the normal structure of the clavicle, how you will identify the abnormal? Okay, before starting with the abnormal thing, first you should know the normal. Okay, for example, actually, if you know the BP, blood pressure 120 by 80, then only you will come to know if it is a more than that, it is hypertension, and if it is less than that, it is called as hypotension. If you don't know this actually limitation, how you will treat? How you will treat the patient, and how you will you can understand what is the abnormality in that? Okay, because of that reason, you should know the applied anatomy, you should more stress on the applied anatomy. Okay, why I categorized this is the color, different colors actually. Because the, if the same question, if it is asked, okay, the clavicle, it is asked for the 3 marks question, clavicle is asked for the 5 marks question, clavicle is asked for the 10 marks question, how you have to write, what are the points has to be covered? If it is asked for the 3 marks question, the first introduction, type of the bone, parts of the bone, neat label diagram, okay, that is enough for the 3 marks question. If it is asked for the 5 marks question, all the this one, introduction, type of the bone, parts of the bone, neat label diagram, and site determination of the bone, and description of the bone. Okay, till that you have to write. Then only you will get the full marks. Then comes with the, if it is asked for the 10 marks question, all the points has to be covered. Introduction, type of the bone, parts of the bone, neat label diagram, site determination points, site determination point, description of the bone, muscle attachment, and the blood supply and the nerve supply, and applied anatomy. These are all the points has to be covered for the 10 marks question. Always the direct question it won't be there. Sometimes what happen, it is in addition. Example, it will be the first define bone, okay, classification of the bone, and explain the scapula in detail or clavicle in detail, whatever it is, like this actually. There's a splitting of the marks also, I will explain it in the next further slide. Okay, how to write, how to split, okay, that also I will explain. These are all the things actually in any bone. Okay, if any bone, if it is comes in the examination, these are all the points has to be covered. The first you should know that actually I have to cover the introduction. Next step will be point wise, because anatomy itself is like a maths. Okay, it is, you should not prepare to pass. Okay, it is very difficult to pass and easy to score. Okay, it is like a mathematics. And many people, it is in the modern science, and as well as the in the modern modern medicine, as well as in ayurveda, the most scoring will be anatomy, but most failures are in the anatomy only. Why? Because it is like a maths. If you write properly step by step, you will get the full marks. But if you miss that, actually definitely it is very difficult to pass. So you should follow these steps actually, point wise explanation, it will help to, okay, improve your maths. Okay, so that whenever there is any bone, if it is asked, actually these points you should keep it in the mind, that actually first I have to start from the introduction, type of the bone, next comes with the parts of the bone, neat label diagram, I have to draw the neat label diagram, and site determination, description of the bone, muscle attachment. Okay, these are all the bones, but depend upon the marks actually, that is also very important. Okay, the time management, okay, that I will delete in the next further slides. Okay, okay, first we'll start from the one by one. Okay, what are the points? So because as I am an examiner actually, if it is asked for the clavicle, okay, I am expecting the student should write, okay, these are all the points in the clavicle. The one is, the very important is, the first you have to, it is the only one horizontal, okay, long bone which is present horizontal, and special features, it is a membranous in ossification and first ossifying bone, and it is having the two ends, that is called as a medial end, it is also called as a sternal end, lateral end, it is called as acromial end, and the shaft, it is in between these two ends, it is called as a shaft. And this shaft is medial two-third and the lateral one-third. It is a medial two-third, it will be anteriorly, it will be convex, and the lateral one-third anteriorly, it will be concave. Okay, so these are all the things actually you have to You have to highlight, because I am expecting that actually there is a conite tubercle. You have to mention the conite tubercle and the trapezoid ridge. Okay, and also there is a subclavian groove, and these two ends and medial two-third and the lateral one-third of the shaft. You have to explain it. If it is not there, then it will be the weightage of the answer, it will be reduces. Okay, if it is asked for the 5 marks, okay, the examiner will expect that these are all the things it should be there in the clavicle. Okay, if it is not there, then the automatically your marks will be reduces. So the neat label diagram, you can see, if you will, okay, in this picture actually you can see in this diagram, okay, all the parts it will be explained. Many people, they will draw the neat labeled diagram. Instead of label diagram, they will more highlighting on the muscles, okay, on the diagram. But no need actually. If it is specifically the muscle attachment of the clavicle, if it is mentioned, then you should need label diagram of the clavicle, then you should attachment, you should mention it. But if it is the explanation of the clavicle, but you have to, the parts is very very important actually. You should highlight these things in the examination. Next comes in the scapula. If it is, the examiner will ask the scapula means, it should contains the two surfaces. It is a flat bone. It is a two surfaces will be there, coastal surface and the dorsal surface, and it has a three borders, three angles, and three processes. Okay, these are all the things has to be highlighted. Okay, completely the picture it should be like this. These are all the headings actually. It has to be all the headings I explained. No, the first it is start from the introduction. Okay, introduction, and the further the classification, everything you have to mention all the bones. But these are all in the scapula means, I need it as an examiner needs, these are all the points has to be covered. Okay, next in the humerus, you should know this actually. In the humerus actually, it is the long bone, okay, which is present, it is the skeleton of the arm. In this actually there are the two ends will be there. One is, there is called as a, okay, this is called as an upper end and shaft and the lower end. In the upper end, okay, while explaining the upper end actually, you should mention that actually head and the two necks will be there. One is anatomical neck and the surgical neck, and two tubercle. One is the greater tubercle, and this one is a lesser tubercle, intertubercular sulcus. And this one is called as a, here in the delta tuberosity, there is a groove which is present, that is called as a radial groove. And here there is a medial epicondyle, lateral epicondyle. These are all the things you have to explain. But it is homologous with the femur. Many people, they will have a confusion in the humerus and the femur. But when the examiner is asked actually the humerus, but you are giving the you are writing the parts of the femur. Okay, but in the humerus, okay, as an examiner they will expect that actually the greater tubercle, intertubercular sulcus, lesser tubercle, anatomical neck, surgical neck. Okay, these are all the epicondyles has to be mentioned properly. Okay, then only it will be fulfilled. Otherwise it's very difficult. So what happen actually, the many people instead in the humerus actually they will write, instead of greater tubercle, it is greater trochanter they will write, lesser trochanter they will write. Okay, and lesser trochanter and neck only they will write the anatomical neck only. So that instead of tubercle, if you are trochanter, if you are mixing the femur with the humerus, then it will be indicates that you don't know properly, so that you lose the mass. So that you should keep it in the mind that actually the humerus means I have to write, these are all the points. It's very very important. If somebody is explaining about the femur, okay, in that actually they will write anatomical neck, surgical neck. Okay, in that paper actually if you'll find anatomical neck and surgical neck, examiner will come to know that actually you don't know anything regarding this. So that you should mainly you should highlight, these are all the things actually. You have to remember properly. Then in the radius and the ulna actually, these are all the parts of the radius. Okay, the radial head it should be there, and radial tuberosity will be there, and interosseous border, medial interosseous border, and stellate process. In the ulna also there is a trochlear notch and also radial notch, that has to be highlighted properly because it is a one of the long bone. But always it is a medial bone and the lateral bone. Lateral bone will be radius and the medial bone will be ulna. Okay, so that always, and the side determination points and the parts of the bone, a neat label diagram. In this diagram you can see, okay, nothing anything is left in this actually. All the Okay, it is a self-explanatory. The diagram itself is a self-explanatory. If you draw the neat labeled diagram, then examiner will come to know that actually you are perfectly you are written the radius. Without seeing your writing part, they will give the full mark. So always you should be concentrating on the diagram, and these are all the things has to be highlighted. Okay, so here you can see in the ulna, actually this is trochlear notch, and this one will be the trochlear notch, and this one will be the radial notch, where there is a head of the radius is articulates. There's a proximal radio-ulnar joint. Okay, that you have to highlight it. Okay, in the next part is in the carpal bones. And the carpal bones, you know that actually the carpal bones are totally, it is 8. Okay, there are the proximal row and the distal row. The proximal row, there are the 4 bones will be there. There is scaphoid, lunate, triquetral, and the pisiform, and trapezium, trapezoid, tapete, and the hamate. Okay, these are all the, this is called as a distal row, and this one will be called as a proximal row of the carpal bones. And the next comes to the in the lower limb, actually in the lower limb, first it starts from the hip bone. Always whenever there is a hip bone is there, first you should understand the question first. Okay, as a part, this is the iliac crest will be there, no, itself is an 5 marks question. Itself is an 5 marks question. Sometimes they will ask for the estabulum, formation of the estabulum, actually it is for 3 marks question. And you should remember that actually the what are the parts of the ilium, and in the intrauterine life how it will be, after the ossification how it will be formed, and individually there's the ilium, ischium, and the pubis, the parts of the bone also you should explain it properly, then only you will get the full marks. Okay, here in this diagram also you should see why I am highlighting the diagrams means it is nothing is left in this part. If you write these diagrams, actually no one is to see your writing part actually. Okay, without saying the writing part only they will give the full mark. Like this actually you have to highlight the diagrams. It's very important. In the femur also, somebody is writing the femur, they should highlight. Okay, see, this is the folia capitis. Okay, and also the head and the neck, it is only having the one neck. Many people they will do the mistake that actually whenever you are writing the femur, many people they will write anatomical neck and the surgical neck in the femur. Okay, it indicates that you don't know anything regarding the femur. Okay, you are read humerus, but you are writing the femurus as a humerus. Like this you are fulfilling the pages. Okay, the intertrochanteric crest will be there. It is a posterior border, actually here you can see this is the intertrochanteric crest in between the greater trochanter and the lesser trochanter. Here also there is the anterior, it is the intertrochanteric line will be there anteriorly, that it should be highlighted. And here in the posterior border it is called as a linea aspera. When the linea aspera, the lateral lip of the linea aspera, it is continuous with the gluteal tuberosity, medial lip it is continuous with the spiral line. Okay, and here there is a medial and the lateral supracondylar line, and this is a medial and the lateral condyle of the lateral condyle of the femur. But here in the epicondyles are also there, lateral epicondyle and the medial epicondyle, that you should be clearly you should be mentioned. And in the epicondyles are more important in the more having importance and the prominence in case of the humerus, but here in the less prominence in the femur. Next one is when they will ask for the tibia, actually it is very articular part will be very important here. You can see this is the medial. Okay, this is called as a medial part, that is called as a medial articular surface, and this one is called as a lateral articular, that is lateral condyle of the tibia. So here the attachment, actually, okay, these are all the attachment. There's a blue part will be there, no? These are all the attachment of the meniscus, and this one is the red part will be there, no? That is called as anterior cruciate ligament, and the posterior in between, that is called as the intercondylar area. This intercondylar area, this is the articular surface which is covered by the cartilage, that is called as the hyaline cartilage. So here in between these two, it is called as the intercondylar area. In this intercondylar area, it will be divided anterior part and the posterior part. The anterior part, okay, there are the three structures will be there. One is that is called as a the anterior end. Okay, the anterior end of the medial meniscus. Then comes with the middle portion, it will be an anterior cruciate ligament. Then comes with the anterior end of the, that is called as the anterior horn of the lateral meniscus. So then comes with the posterior area, that is the first, it starts from the posterior end of the lateral meniscus, and posterior end of the medial meniscus. Then comes with the posterior cruciate ligament. Here, this is in the lateral, it is a circular. The meniscus will be there, no, it is a circular. Here, there is a semilunar. Okay, because of that reason, this attachment it will be varies. Okay, these are all the things actually. The neat labeled diagram only, it will give the clear cut picture regarding the your knowledge. Then tibia and the fibula. Okay, these are all the two bones which is present in the leg. The tibia is the medial bone. In the tibia, okay, if you are writing the tibia, okay, there is an explanation we need actually. The explanation regarding the examiner will expect the medial condyle has to be explained, lateral condyle, and there is the intercondylar area has to be explained, and that is tibial tuberosity and the shin of the tibia, and also there is a medial malleolus has to be explained properly, and also the borders and the surfaces. And in the fibula actually it is a vestigial bone actually, but the fibula, the head of the fibula has no role in the formation of the knee joint. But here in the lower part, that is called as a lateral malleolus, which forms the contribution in the formation of the ankle mortise. Ankle mortise in the lower part, it is important actually. In the whenever you are writing the fibula actually, in the neck of the fibula, there is a the common peroneal nerve. It will be divided into two parts: superficial peroneal nerve and the deep peroneal nerve. Whenever there is an injury to the fibula neck, actually neck of the fibula, that may, okay, neck of the fibula, that may damage to the common peroneal nerve. Okay, that may lead to the foot drop. Okay, there is a paralysis of the peroneal nerve. Then comes to the ankle, and here there is a foot. Okay, here the totally it will be the tarsal bones will be seven tarsal bones will be there. The one is the calcaneum, and this one is the talus, navicular, and the cuneiform. Three cuneiforms will be there. That is the medial cuneiform, intermediate, and the lateral cuneiform, and the cuboid. Okay, these are all the metatarsal bones. The one, two, three, four, fifth metatarsal bones, and totally there is a 14 phalanges will be there. Here there is a phalanges in the great toe. It will be having the two phalanges, that is called as a proximal phalanges and the distal phalanges. And in the second toe, it is having the three, second and third, all the having a three phalanges. One is proximal, middle, and the distal phalanx. Like this we have to, because anatomy knowledge it is required for the clinicians. Why? Because in all the investigations, we can see the radiological findings, that is X-ray, MRI, all it is anatomy itself is a medical language. Okay, because the medical language, so these terms they will be utilized, they will be using in the whole medical science to diagnose, okay, and as well as a treatment. So this is very anatomy is very important. If you know the anatomy, you can understand the MRI, you can understand the X-ray, all the findings you can easily you can understand. So next we will come to the skull actually. The skull, it is the divided into the mainly there is a two, the cranium, that is called as neurocranium. Okay, it is a cranial vault which protects the brain. Okay, and viscerocranium. Viscerocranium means there is a the face actually. Okay, which is the part of the cranium which is present in the face. Okay, that is called as a viscerocranium, which is the formation of the orbit and the nasal cavities. Then here there are the parts in the side of the parts actually. You should know this parts actually. One is this one is called as a frontal bone and parietal bone. In between these two, frontal and the parietal, there is a suture. It is called as a coronal suture. And here this is called as a parietal bone, and occipital bone in this is called as a lambdoid suture. And here this is called as a temporal bone, and this one is called as a sphenoid bone. Okay, these are all the lateral view. What are the structures? You can see it in the skull. Okay, in the frontal view, what are the main bones actually? You can see this is the lacrimal bone. Can you able to see here? This is the lacrimal bone, and this is zygomatic bone. It is also called as a boxer's bone. And whenever there is in the boxing, actually there is a fracture takes place in the zygomatic bone. And this is called as inferior nasal concha and maxilla, and this is called as a nasal bone, and this one is called as a mandible, and this one is called as a omar bone. These are all the bones it will be visible in the frontal view. That is called as norma frontalis. Then comes with the norma lateralis. That is the lateral aspect of the skull. Here in the lateral aspect, there is a this one is called as the first one, it is called as a parietal bone, and this one is called as a frontal bone, and the third one is called as a occipital bone, fourth one is called as a temporal bone, fifth one is called as a sphenoid bone, the sphenoid bone, and then comes with the sixth one is called as a mandible bone. This one is called as zygomatic bone, and this one is eighth one is called as a maxillae, and ninth one is called as a lacrimal bone. This is where there is the lacrimal apparatus is situated, lacrimal bone, and this one is called as a nasal bone. Okay, these are all the normal lateralis. Okay, lateral aspect, what are the bones you can visible, okay, from the skull bones. And the cranial base, okay, you can see the inferior aspect of the skull, which presents the six different bones. You can see here, this is called as the palatine process of the maxilla. Okay, this is the part of the maxilla, but it is towards the process, means the bone, it is attaches to the palatine, so that is called as the palatine process of the maxilla. And here the second one is called as the hard palate. In that hard palate, there is a combination of these two, the palatine process of the maxillae and also the palatine bone. This is second one is the palatine bone. Then comes with the sphenoid bone. There is a third one is called as a sphenoid bone, and the fourth one is called as a omer bone, and fifth one is called as a temporal bone, and sixth one is it is called as a occipital bone. These are all the cranial base. What are the bones? It will be visible. Then comes with the very important. Sometimes it is asked for the 3 marks question. Orbit. The orbit means totally the 7 bone articulate to form the orbit. Okay, here you can see. Okay, this one is called as a orbital part of the frontal bone. Can you see here, orbital part of the frontal bone? And this one is called as a zygomatic bone, and the third one is called as a maxillary bone, and the fourth one is the lacrimal bone, fifth one is the ethmoid bone, and sixth one is the palatine bone, and seventh one will be the sphenoid bone. Okay, these are all the bones actually it will be form the orbit. Okay, totally the 7 bones which forms the articulates to form the orbit. This is very important. Sometimes it is asked for the 3 marks question, so always you should be concentrate on the draw the neat labeled diagram, and you should explain it. It will be ideal. Then comes with the in the cranial bone. Okay, in the foramina actually how the cranial nerves it will be. It will be passage for the cranial nerves. One is the cribriform plate of the ethmoid bone. Can you see here, cribriform plate of the ethmoid bone, which is the first cranial nerve that is called as olfactory nerve, and this one is the second foramen that is called as the optic canal. In that actually the optic nerve it will be passage, and this is called as the superior orbital fissure. In this actually there is a third cranial, that is oculomotor, trochlear, and the first division of the trigemma, that is called as the ophthalmic division of the trigeminal nerve, and the sixth one it is called as the abducens. Okay, this nerves it will be passing. And the next one is there is a foramina rotundum. Foramina, this is called as a foramina rotundum, which is the cranial number 5, that is called as a trigeminal nerve. That is the second division of the trigeminal nerve. That is itself indicates that is the maxillary division of the trigeminal nerve. Then comes with the foramina ovale. Foramina ovale, that is the third division of the trigeminal nerve. That is called as a mandibular division of the trigeminal nerve. Trigeminal means the 3 divisions will be there. One is ophthalmic, maxillary, and the mandibular division. Then comes with the here there is a internal acoustic. Okay, internal acoustic meatus. That is a cranial number 7. That is a facial nerve, and eighth one it is called as a vestibulocochlear. These two nerves it is coming out from the internal acoustic meatus. Then comes with the hypoglossal canal. Okay, here can you able to see here hypoglossal canal, that is the cranial number 12. That is a hypoglossal nerve it is passing. And next one is the jugular foramina. In that jugular foramina there is a ninth, there is glossopharyngeal, 10th one is the vagus, and 11th one will be the accessory nerve. These nerves it will be passing from the jugular foramina. This is also very important actually. So if the diagrammatic presentation is there, it will be more impressive, and also it is very easy to remember. Okay, I told you earlier, it is like a maths. Okay, if you perfectly if you are written, you will get the full marks. If you are not written properly, then you will lose the marks. So don't try to prepare for the passing. Okay, just prepare for the scoring actually, then only it is very easy to score. It's very difficult to pass. So next, this actually the ribs. Okay, the ribs it will be the true ribs, the first 7 ribs, and false ribs. In that false ribs, okay, there is a 8 to 10, it will be the false. In that actually the 11th and 12th will be considered as a floating ribs. Okay, these are all the classification. And the sternum also, manubrium sternum, body of the sternum, and the xiphoid process. And this is, can you able to see here, this is called as a costal cartilage. Okay, okay, this is called as a cartilage, and this one is called as a bones actually. So this junction, it is called as a costochondra. Costochondra. Okay, there is a costochondritis. Okay, there is the inflammation. Okay, where there is a junction of the ribs which is articulates with the cartilage, that is called as the costochondritis. There is the inflammation. Okay, that's one of the clinical conditions of the costochondritis. Next comes with the vertebrae. You should know that actually how many vertebrae are there and how it is divided, and what are the significance, and how we have to differentiate the cervical, thoracic, lumbar. Okay, lumbar actually. You should know that actually very easily. Okay, the cervical, all the cervical is having the one foramina that is called as foramina transversarium, which is present in the transverse process. That indicates that it is a cervical vertebrae. And coastal facets means where the ribs is attaches. Okay, coastal facets which is present, okay, which is present on the body, and the transverse process which is present in the thoracic vertebrae. Then in the lumbar actually, the lumbar, there is a divide of the coastal facets and divide of the foramina transversarium. That itself, it is indicates that the lumbar bone. Okay, that is called as the lumbar vertebrae. And here the vertebrae is a singular, vertebrae will be the plural. So here in the sacrum, okay, sacrum, it is a fused bone. Okay, totally it will be 26 number. And somebody will ask in the examination actually how it is 26 and how it is 33. The if the sacrum and the coccyx will consider separately, it will become a 33 numbers. And if the sacrum has a 1 and the coccyx has a 1, if we consider, it will be 26. So that you should remember that actually the counting also very important. And also there is a curvature also in the intrauterine life. It is in the C shaped. Okay, it will be, this curvature is there, no, it will be in the C shaped. That is called as anteriorly it will be concave and posteriorly it will be convex. But in the when the baby head will be fixes, no, at that time actually secondary curvature of the cervical vertebrae takes place. When the baby will walk at that time after 1 year, okay, so at that time there is a secondary curvature of the lumbar vertebrae, it will takes place. Okay, these two changes. So because of that reason, okay, there is a most movable part of the vertebral column will be cervical and the lumbar vertebrae. So here you can see this is the, after this curvature it will be anteriorly, initially anteriorly all the vertebral column, it will be anteriorly concave, posteriorly it will be convex. But here in this actually secondary curvature, the anteriorly, the convexity, it is the convex, anteriorly it will be convex, and here as posteriorly. Okay, here in this cervical, usually it will be anteriorly it will be concave, but cervical it is changes, anteriorly it will be convexity, and thoracic it is remains as it is, anteriorly it will be concavity, and lumbar usually initially it will be concavity, but it is converted into convexity, and sacrum and the coccyx it will be same. So this curvature, there is a secondary curvature, it will be takes place in the cervical and the lumbar vertebrae. Okay, this is very, very important. Because of that reason, most flexible part of the vertebral column will be cervical, and also it is in the lumbar. So more stress, wherever there's a more flexibility is there, more stress on the cervical and the lumbar also. Because of that reason, you may heard about the upper anatomy, as upper anatomy in the clinical anatomy, cervical spondylosis and the lumbar spondylosis, it is a most common. Okay, and this is actually the alignment of the AP view, that is called as anterior posterior view of the spine. And the one more important point is there. Okay, first we have to highlight the time management while writing the paper. That is also very, very important. Why? Because many people after the examination, your friends, your seniors, you may have heard about that actually, I didn't get the time to attend the question. Okay, I didn't get the time. Okay, this is why this happening means because of the you don't have a time management. Okay, that is very, very important, how to manage the time while writing the examination. The first one is, there are the totally the three category question paper will be there in the questions. One is the long essay, short essay, and short answers. Okay, long essay. In that long essay, actually, there is a totally the 10 marks question. The 10 marks, two questions will be there in the question paper. In the short essays, the 5 marks, the 10 questions will be there. and the short answers, the 3 marks, 10 questions will be there. Totally, you have a 3 hours time. That is called as a 180 minutes. 180 minutes. How we have to the reserve the according based on the mass, how much the minutes has to be reserved for the each question. That is also very important. Here in the long essays, the totally it will be okay. Can you see here? This is actually the 10 marks question. You have a 10 marks, two questions will be there. Okay, totally it will be 20 marks question. So the each 10 marks question you have to spend the 15 minutes. Okay, 15 minutes. So after finishing the 15 minutes, you should stop where you are there. Why? Because the time, if you, the consumption of the time, if you know the clavicle well, okay, the someone has asked for the two questions would be there. One is scapula and one is the clavicle. Just example I am giving. If the clavicle you know perfectly, scapula you don't know, so that you are writing for the more the instead of 15 minutes you are taking the 30 minutes, half an hour you are writing only clavicle in detail, but no use. Why? Because the maximum marks allotted, okay, allotted for the each question will be 10 marks only. If you are written for the 10 pages or 20 pages in for only the long essay, means we can able to give only 10 marks only maximum. So you should remember that actually you should attend. Okay, the 15 minutes means 15 minutes you should finish. Okay, first long essay. Then another 15 minutes you should finish the second long essay. The 30 minutes you should finish the long essays, then only you can manage the time. Okay, then short essays it will be 5 marks. Okay, totally the 10 questions will be there. Each question you should spend 10 minutes only max. Maximum it will be 10 minutes. Okay, the 10 questions totally it will be 100 minutes. Totally 130 minutes are over for the 5 marks and the 10 marks. Then the short answers, there is a 3 marks question, 10 questions will be there. Okay, the 4 minutes, can you see here, this is the 4 minutes you should spend for the 3 marks for each question, and 10 totally it will be 40 minutes. 100 130 plus 40, totally it will be 170 minutes. Okay, the 10 minutes it is left. Okay, always we should keep it 10 minutes, because earlier what happened actually, the question number you have to write. Some people while evaluating, I have seen the many answer booklets actually, but someone is missing the question numbers only. Now the university has made that actually they are printed the question number. Okay, because to save the, because some people they will be unnecessary they are writing, and while evaluating actually the first question will be here first page and second question will be in the last page because of very difficulties. Okay, so the BOS they are taken the decision that actually the question numbers has to be printed. Earlier there is no question numbers. You have to write the question number. Some people they are written excellent presentation is there, but even though they are not written, they are not written the question number properly. So what happen if you are not written the question number, then again it will be some people the first evaluator, okay, just I will consider, okay, you are written very good, then I will given for that question the marks I allotted. But someone, the second evaluator, he is very strict actually. Okay, even though you are written the properly, but you are not written the question number, how you can allot the marks? That is also very important. So that he has allotted not attempted. So then what happened? There is a third evaluation. There is a one person, the same question attempted and he has allotted the marks, and second examiner he has wrote that actually it is not attempted, then it will be go for the third valuation. That is very difficult actually. So the third evaluator, how he will consider, depend upon that you will get the marks. So these are all the things actually. Now it is easier actually, the question number itself it is printed in the paper now, but you should maintain the time sense, and also unnecessary things you should not write. You should not waste the time. Answer is to be to the point. So if you draw the neat label diagram, then a diagram it is a self-explanatory. I told you again and again why I'm stressing this, because the anatomy itself it is a structural study. You should highlight on the diagrams. So if you draw the neat label diagram and all, it will be very impressive, and the examiners will see the diagram. Then he can allot easy to allot the maximum marks with your markings, with your explanation. Then comes with here you can see the totally you are spending the time with the 170 minutes. 10 minutes it is for the important points to be highlighted. Okay, the 10 minutes, it will be some of the important, you feel that actually it is very important. These things you should identify coolly and you should highlight it actually. Okay, that is very important in the totally it will be 180 minutes, so 3 hours you have to manage. Okay, means 10 minutes means the longest is 10 marks, the 15 minutes means you should stop the 15 minutes, then only you can able to manage. Otherwise, in the end of the examination, okay, end of the paper, actually you will come to know that actually didn't get the time, I have missed the 3 marks short answers, 3 questions, and short essays 1 question, and long essay 1 question. It is not the answer actually. Okay, so you have to time management also is very important in the examination. And the example, okay, the time management with how to write, that is also very important. Just I will give the one example actually. The first, the question will be define bone, define bone, classification of the bones, and explain the scapula in detail. Okay, this is the question, it is asked for the 10 marks. It is a maximum allotted will be the 10 marks. You should divide it. Okay, you should divide it yourself. Define bone, there is a definition of the bone, it is for the 1 marks only. Okay, many people they will write, okay, in the they will write that actually only definition, for 1 page definition they will write. Okay, 1 page definition, it is no need. Okay, the defined bond, it is 1 2 line is enough, because maximum marks it will be allotted for the 1 marks only. The classification of the bonds, it is for the 4 marks. So all the 4 categories you have to explain. Okay, you have to write, then you will get the full marks. That is called as a 4 marks. Clear? Then explain the scapula, that is for the 5 marks. Okay, 1 plus 4 plus 5. Okay, then only you will get the whole 10 marks. Many people, I wrote 4 pages, 5 pages, but even though I got only the 2 marks, 3 marks. Why? Because someone has written the definition of the bone, they missed the classification of bone, directly they are explain the scapula. But what happened, you are missed the classification marks, classification of the bones, then your marks it will be reduces to the only 6 marks out of 10 marks, because this 4 marks will be there, no, it is allotted for the classification of the bones, that you are not attempted. Okay, without attempting this, how you will get the full marks? So if you are written only definition is for 1 page, okay, then classification you wrote, then explanation of the scapula is not there. So your marks 10 marks it will be reduces, maximum it will be 5 marks only. Then whatever the properly how much proper you are written, based on that only, out of 5 marks you will be allotted for the marks. Okay, so this is very very important, you should remember. Earlier actually, earlier we are in the DNB, actually in the DNB examination it will be like this only. Okay, the defined bone, classification of the bones, explain the scapula means 1 plus 4 plus 5 equal to 10. Okay, that itself it will be explaining in the question number. But here, okay, we are proposed actually, okay, you should mention this actually, but no one is accepting. Why, I don't know. But even though these are all the very important things actually, you should remember while writing. Okay, you should cover all the headings, then only it will be maximum marks will be allotted for the 10 marks. If you have written any one or any two, okay, then your maximum marks also it will be reduces. So in that how much you are written, based on that only they will allot. So very important that you should remember how to write the examination part. Okay, yes, any doubts? Hopefully, because one bone actually it will take 2 hours time, so it's very difficult to explain that, because it's not a theory class, it's the exam oriented class. So just whatever the I know actually, that I shared with you. Any doubts?
Thank you, sir, for such a wonderful session.
Thank you very much, madam. Madam, actually, because the osteology, because class we can't able to take, because one bone actually it will take the 3 hours actually. So just exam point of view, what are the things has to be highlighted? I explained them. Hope all the students will benefited with this lecture. Thank you very much, madam.
Thank you so much, sir, for sharing your expertise with us. On behalf of Department of Sharir Rachana, we are very grateful to you. Thank you, sir. So tomorrow On 29 December 2020, we have Dr. Jacinta Ma'am, Vice Principal and Professor, Department of Sharira Rachana, Karnataka Ayurveda Medical College, Mangaluru. Ma'am will be talking on the topic digestive system. So at the end, I thank all of you for your active participation in this guest lecture on exam orientation program Rachanavadhana 2020. Thank you, one and all.